Before knowing the general signs and symptoms of cerebellar disease, you should know that an injury to one cerebellar hemisphere always produces signs and symptoms on the same side of the body and not on the opposite side. So when there's dysfunction of the cerebellum, hypotonia is observed, the muscles become flaccid, and there's increased resistance to passive movements of the joints. Secondly, there's tremors or intention tremors, which are basically shaky movements produced due to rhythmic involuntary contraction of muscles. And an intention tremor is when the tremor appears when a voluntary movement is attempted, like buttoning your shirt, and otherwise it does not happen when a specific body part is at rest. Dysmetria is basically the inability to estimate a distance correctly when performing a specific movement. For example, when the patient is asked to touch the tip of their nose with the index finger, they will either pass that point or they will hit the nose somewhere else. Dysarthria is a speech disorder which occurs due to uncoordinated movements among the muscles of the larynx, so the person has difficulty speaking and their articulation is jerky and not smooth. Nystagmus is the rapid rhythmical movements of the eyes, and it could be a pendular nystagmus or a jerk nystagmus. A pendular nystagmus is when the rate of movements is the same in both directions, for example, right or left, up or down. And a jerk nystagmus is when the movement is rapid in one direction and slow in the other. Dysdiadochokinesia is the inability to perform rapid alternating movements, for example, supination and pronation. Ataxia is a general term which means the loss of coordination of voluntary movements, and in this we can observe a staggering gait, and a broad-based gait is also observed in which the person spreads their feet wider apart to walk. And another general term related to movement is decomposition of movement, which basically means that muscle groups fail to work together in union. So when a movement is attempted, the movement is not smooth. Instead, it is jerky and it takes place in a series of components. Postural changes that may be observed are, on the affected side, the head is rotated and flexed, and the shoulder is lower than normal. When the patellar reflex is done, a pendular knee jerk is seen in which the knee continues to swing in flexion and extension, and this is because the cerebellum loses its control over the stretch reflexes. To understand the next two syndromes, you need to remember the functional areas in the cerebellum, which are the vermis, the intermediate zone, and the lateral zone, and what structures, what muscles they control. Since the vermis controls midline structures, there is muscle and coordination between the head and trunk. It's difficult to keep the head and trunk upright, and there's a tendency to fall either forwards or backwards. And the most common cause of this syndrome is a medulloblastoma. Cerebellar hemisphere syndrome may be caused by a tumor of a hemisphere, and since it involves the intermediate and lateral zones, the signs and symptoms are related to those areas. For example, the movements of the limbs are affected, they become uncoordinated, and there is difficulty initiating movements and the inability to move all parts of a limb in coordination. So here's a summary of the general signs and symptoms of cerebellar disease. Credit goes to the original owner.